Hi everyone, welcome to renal physiology. Today we are continuing with where we ended. We are looking at the juxtaglomerular apparatus. So under this, we are going to describe the location of this juxtaglomerular apparatus and the function of the juxtaglomerular apparatus. Okay, so this is the juxtaglomerular apparatus. Okay, and where is this same juxtaglomerular apparatus located? Okay, let me zoom a bit. First of all, the juxtaglomerular apparatus, it is made up of three types of cells. Here. The juxtaglomerular apparatus is made up of three types of cells. There is the granular cells, which are also called extramesangial cells. And there is macula densa cells, which are also there's no another name for the macula densa. And then the other ones, we call them the JG cells. Okay, they are located somewhere here. The JG cells are located on these are modified smooth muscle cells that are able to secrete renin. So, just from the knowledge of the nephron, this diagram shows exactly where these same juxtaglomerular cells are located. So you find that this juxtaglomerular apparatus, they are located on the distal tubules, they are located on the afferent arterioles, they are located on the efferent arterioles. Okay. So on the afferent arterioles, we have what you call the JG cells. These are modified smooth muscle cells on the afferent arterioles that secrete renin. And then on the distal cells, we have what you call the macula densa. The macula densa, they are like chemoreceptors. Okay, they sense the levels of sodium and chlorides in the tubular fluid. They sense the levels of chlorides and sodium in the tubular fluids. We are going to see later on. And then the efferent, okay? The efferent arterioles here, what can we see here? We can see the extramesangial cells. Actually, the extramesangial cells, they are located between the efferent arterioles and the afferent arterioles. Okay, that's where there is extramesangial cells. These efferent arterioles, they are responsive to the action of angiotensin II and also arterionatriuretic peptide. So that's the location of the juxtaglomerular cells. So we can also look at this from this view. We have the macula densas, we have the juxtaglomerular cells, which are called JG cells, which secrete renin, and then we have the extramesangial cells. But it's important to note that you should not confuse these mesangial cells which are found within the glomerulus. These are called intraglomerular mesangial cells. Okay, these are not really part of the juxtaglomerular apparatus, but you are going to see that they regulate the filtration rate, which we call the glomerular filtration rate. You are going to see later on that these are phagocytic cells. That is, they're involved in immunity. And also, you're going to see that they secrete prostaglandins, cytokines. Okay, cytokines are just proteins that are signaling molecules, and they mediate and regulate the immunity. They regulate inflammation and hematopoiesis. And then the prostaglandins, these are lipid in nature, and they are made at site of tissue damage or where there is infection. And then you're going to see that these, they control processes such as inflammation, blood flow, formation of blood clots, at the induction of, formation of blood clots. So these are intraglomerular cells. Okay, another view, just to appreciate the JG cells, you can see there's a juxtaglomerular cells there, okay, and you can see there's nerve fibers, sympathetic nerve fibers. So they are under the influence of the sympathetic nerve fibers, and there we have the extramesangial cells, and which lie between the afferent arterioles and efferent arterioles. Okay. Now, what's the function of this same juxtaglomerular apparatus? One, they're involved in secretion of hormones, such as renin and prostaglandins, as we saw. They are also involved in secretion of other substances by the extraglomerular mesangial cells. These substances are important in immunity, inflammatory responses, such as cytokines, interleukin-2, tumor necrosis factors, and thromboxane. The other function of the juxtaglomerular apparatus is that they regulate glomerular blood flow and glomerular filtration rate. So what this means is that they regulate the diameters of the afferent arterioles and the efferent arterioles. So when these diameters are regulated via vasoconstriction and vasodilation, it means it will affect glomerular filtration rate. Okay. Look at this renin. We said renin is secreted by which cells? The JG cells. We're going to see when we look at regulation of blood pressure that renin, okay, it's secreted by the cells called the JG cells. The major function of renin is to convert a protein which is synthesized by the liver. This protein is called angiotensinogen. Okay, it converts this protein into angiotensin 1. And then there's an enzyme which is produced by the lungs. It converts angiotensin 1 to angiotensin 2. Okay, angiotensin 2 is a very potent vasoconstrictor. As you can see, it constricts the blood vessels. Angiotensin 2 also influences reabsorption of sodium and water. That is, it increases reabsorption of water. On the heart, it causes cellular hypertrophy. Okay. On the adrenal gland, it stimulates the adrenal gland to produce aldosterone so that there is increased production of, increased absorption of sodium. And then on the brain, it stimulates vasopressin secretion and sympathetic activation. As we know, ADH prevents diuresis. Okay, so it increases water reabsorption. So we are going to come again to this, but here it's important to know that renin is secreted whenever there is low blood pressure or whenever the extracellular volume is decreased. Okay. And then we said the extramesangial cells, okay, they are a type of smooth muscle cells, and although their function is yet to be fully clarified, they play a role in autoregulation of blood flow to the kidneys. We are going to describe this concept later on. We know that about 1,200 mils of blood per minute flows to the kidneys. So there are situations whereby this can reduce or increase. So the kidney can autoregulate. It can regulate the amount of blood flowing to it. Okay. We're going to look at this mechanism later on. And then we've said that the macula densa The macula densa senses the levels of sodium in the tubular fluid. Okay, it senses the levels of sodium in the tubular fluid. For example, let's start from here. Whenever the arterial pressure drops, that is, the blood pressure becomes low, it will mean that even the rate at which the filtrate is filtered will reduce. That is, the glomerular hydrostatic pressure will reduce, leading to the reduction also in the glomerular filtration rate. When this happens, there will be decreased delivery of sodium chlorides, okay, to the macula densa. Remember, the macula densa, it has the channels called the sodium potassium 2-chloride transporters. So there will be decreased delivery of sodium to the macula densa. Okay. So what happens? Whenever there is decrease of sodium to the macula densa will release what we call adenosine. Okay. And then the adenosine will act on the Golgi cells. Okay, will act on the Golgi cells, and then there will be increased secretion of renin by the Golgi cells. And we know that renin will result into conversion of angiotensinogen to angiotensin 1, and then angiotensin 1 will be converted to angiotensin 2. At the end of the day, we are going to see an increase in efferent arteriolar resistance. Therefore, we are restoring the pressure, the blood pressure. Okay. So apart from that, the macula densa has an effect on the afferent arteriolar resistance. It reduces, meaning that it causes dilation. Okay. It causes dilation. This is what we want. We want we want GFR to increase. Okay. So in short, what we are trying to say is that the macula densa responds differently to decrease in renal blood flow. Okay. It also responds differently to increase in renal blood flow. So I've said that whenever there is decrease in renal blood flow, it will mean that there will be decrease in glomerular filtration rate. It means there will be decrease in sodium delivery to the macula densa. It means that the macula densa will begin to secrete adenosine, and adenosine will act on the afferent arterioles. Okay? On the afferent arterioles, there will be decrease in calcium delivery, okay, into the smooth muscle. We say the Golgi cells are some kind of smooth muscles. And then it will lead to vasodilation, that is smooth muscle relaxation, thereby resulting into increase in renal blood flow. But whenever there is increase in renal blood flow, okay, whenever there is increase in renal blood flow, what happens? Whenever there is increase in renal blood flow, okay, I think I'm getting, let me repeat. I have a feeling that some people are not following. I'll start here. We're trying to talk about the response of the macula densa to changes in renal blood flow and increase in the renal blood flow. So we are saying whenever there is decrease in renal blood flow, it means there is decrease in glomerular filtration rate. It means there is decrease in sodium delivery to the macula densa. Okay. This will mean that there will be decrease in secretion of adenosine, but there will be increased secretion of prostaglandins, bradykinin, and renin. Now, these prostaglandins, they'll have an effect on the afferent arterioles. The prostaglandins and the bradykinin, they will have effect on the afferent arterioles. The afferent arterioles will dilate. But again, renin will have effects on angiotensin 2. And angiotensin 2 will not act on the afferent arterioles, but it will act on the efferent arterioles. Okay? Efferent arterioles. So when it acts on the efferent arterioles, it causes the decrease in calcium entry into the efferent arterioles, which will result into vasodilation. When you know the blood vessel vasodilates, it means there'll be increase in blood flow. Okay. So now, whenever there is increase in renal blood flow, here what will happen is that there will be increased sodium delivery to the macula densa. There will be increased secretion of adenosine, which will cause vasoconstriction. Okay. So we'll still come back to this when we are talking about renal autoregulation. So we are going to end here. So in summary, what we are trying to say is that there are three cells of the juxtaglomerular apparatus. We have the afferent arterioles. We have on the afferent arterioles the JG cells, which secrete renin. We have on the distal straight tubule the macula densa, which are sensitive to sodium levels. And then between the afferent arterioles and the efferent arterioles, we have the extramesangial cells. Okay. Thank you very much.